wonder if you can treat effectively a compression fracture of the spine just as well as anyone else. I thought that. In fact, I didn't know if I could treat it any better than anyone else. What could I do for these patients? They've got a fracture in their spine. When we dug into the research, we found there's a lot of things that we can do as a profession for vertebral compression fractures. So today's blog, I'm not only going to ask that question of what we can do for it, however, I'm also going to give you the information of what we can teach our patients about vertebral compression fractures. Because as it turns out with this kind of a diagnosis, it's not so much what we can do in office, it's the patient education and us teaching the patients everything that we know about the situation so they can make informed decisions about their activity level, their activities of daily living, what kind of things they're going to do and not do to prevent future exacerbation of symptoms. Because what we're going to find out in this blog, that jumping through a procedure or just taking medication and laying in bed aren't necessarily the best options, even though in the short term, it may feel good. Can you treat osteoporotic compression fractures in your office? Yes. Chiropractors should be treating these compression fractures in their office, and here's why. Chiropractic is not a modality, it's a profession. And there are three things that these patients need more than anything else. The first is palliative relief, using modalities and any kind of soft tissue to relieve the symptoms this patient's having. Number two, patients need to avoid any kind of exertion and need to be provided ADL information on how to get through this painful time. And number three, we need to implement procedures to prevent re-exacerbation and future compression, all the things we do as evidence-based chiropractors. How can you diagnose an osteoporotic compression fracture in your office? Obviously, you want to use X-ray. However, the orthopedic tests that are best suited to make this diagnosis are number one, the supine sign. The patient's unable to lay on their back. The BPIT test, having the patient lay on their back, roll to their side, and then get up. And then finally, the heel drop test. And one thing about the heel drop test is when the patient's standing up straight and they drop their heels to the ground, they're going to put a lot of axial compression through the spine. That's positive for an osteoporotic compression fracture. However, if you have the patient leaning forward, it's actually looking for a disc problem. So making sure the patient has excellent posture during this test will help you make the differentiation between a disc problem and a possible compression fracture. What are the invasive treatments we can utilize for osteoporotic and vertebral compression fractures? Vertebroplasty and kyphoplasty are two most common procedures formed. However, these do carry risk. While they do decrease acute pain, they do actually stiffen the bone. In fact, 7 to 10 times stiffer than normal bone. So adding cement to the intervertebral body creates problems for the future. In fact, about 25% of people that have these procedures have a future compression fracture at the level above. So while vertebroplasty and kyphoplasty are good for acute pain, long-term outlook doesn't look any better than conservative management. Educate your patients appropriately.